Good morning, everybody. I'm Scott Michlin, and Megan Cullop is off today. She is on assignment, so it is me flying solo this morning. But welcome to our community information program about COVID-19. Today is Thursday, October 22nd, 2020, week number 32 of the program. And I am so glad that you are with us this morning. Coming up today, we've got some great guests lined up, including Farmington Mayor Nate Duckett. He'll be speaking with me in the next few moments live this morning. Also, Dr. Brad Greenberg spoke with Megan and me yesterday afternoon, and we'll be playing that interview for you a little bit later on during the program. So we're glad that you are with us this morning. So thank you very much, everybody. The program, of course, is streaming live on Facebook, YouTube, and Twitter Mondays and Thursdays at 9 a.m. It is rebroadcast on KSJE Radio every afternoon at 5:06 p.m. And you can also hear it on our partner radio station, by the way, KNMI. That's Vertical Radio. They play the program on their station every day, Monday and Thursday at noon on KNMI. So we're glad that they are in partnership with us to provide this community information. Let me go to my first guest, who is on the phone this morning. Good morning. You're on KSJE. This should be Mayor Nate Duckett.
Good morning, Mr. Michlin. It is Nate Duckett. How are you?
There he is. I can tell by the ring of the phone. I'm well, Mayor Duckett. Good to have you with us this morning. I know Megan asked you to come on the show, and then she's not here, so it's just you and me. How about that?
Hey,
go figure.
We've been here before. It's okay.
That's okay. I know. We have plenty to talk about. And I guess let's start with maybe just, how things are going in the city. Now, we know that there are still businesses that are struggling, of course, and we know that the students may be struggling if they're not in school and there's virtual learning and things along that line. But in your position as mayor, can you give us kind of an overview of what things you are seeing from City Hall?
No, I think it's really interesting, kind of the dynamics of what's taken shape over the past 7 months. And just my appreciation, I just want to say this, my appreciation to the people of Farmington for adapting on so many different levels, what they do on a regular basis, the innovation that's kind of taken place here in our community in regards to, kids distant, learning at home, the way the schools have come together for those things. And I realize there are still great challenges that many of us face and our students face, even with these new ways of learning from the house. But I just want to say thank you to the teachers, to the healthcare workers, to our frontline workers. Thank you for the great job that you're doing and being able to adapt during these times of troubles. Troubles that we're going to work through and we're going to make it through. I think that's the key right now is we have to continue to put those things in the forefront of our minds. And one of the things I've always lived my life with is you always have to think with the end in mind. So there's a plan. You're executing that plan. You've got goals. You've got strategies. But you got to think, what does it look like when we've completed this? And I think we're getting closer to that all the time. So it is what we're seeing from City Hall. Certainly is just continued ups and downs within different business sectors. It's really interesting, Scott. Retail has done really well during COVID. Retail sales are up in the city of Farmington versus last year. We had planned a 20% deficit to budget. So far, year to date, we are only down 8% to last year. So we're actually, we're 12%, 13% better than what we had budgeted for. So that's good. We're managing those expenses correctly, and that's good news. Go ahead.
That is interesting, Mayor Duckett. I was going to ask just about that number that you mentioned, or how you know that the retail sales are up. That is from the gross receipts taxes that are collected on sales within the city limits?
Correct. So we've received, our fiscal year starts July. And so for the fiscal years and gross receipts taxes, just so everybody knows, when businesses pay their gross receipts tax, it goes to the state of New Mexico. State of New Mexico then divvies out to the municipalities and the counties their portion of the gross receipts tax. So we run about 2 months behind where we're at right now. So I think we just received August's gross receipts tax information, and for the month of August we were down about 7.5% to last year, but that's roughly 13% better than what we had planned for. So that's where that information comes from, and you can see it broken down by sectors. Construction in the city this year is doing well. Retail's doing really well, and retail, of course, is the biggest portion of where we receive gross receipts tax that funds your local services. So, but there are those that are still, you've got limitations placed still on the restaurants, you've got limitations placed on entertainment venues, and of course, just the general concern of, people are certainly doing the right things, making sure they're taking care of their health, and not engaging in many activities that they were before that businesses have provided services. So we're still seeing that, and this week the governor put out kind of her plan for restaurants. All restaurants have to take the safe COVID practices training. This training,
that's right.
Yep, get certified in that. That way they are allowed. That's going to be the key for them to maintain indoor dining. And so certainly, I put the word out to individuals. I'm at my full-time job today, and we insure a lot of restaurants, and so we put a lot of information out, making sure, hey, make sure you get the certification done so you can keep your doors open, not just have to sit people outside in the cold. So
right, and that training, as far as I understand it, is free to these businesses from the state, correct, for them to take part in this?
Absolutely is, and you can find that training on City of Farmington's website. You can find it on the Chamber of Commerce. I know Jamie Church immediately put it out
right.
for people there too. So it's there. I've been talking to restaurant owners about it. I know I talked to two personally that went out and right after that announcement they signed up to take it, and then I talked to a couple others that had already done it. So
very good. And Mayor Duckett, I know earlier on you were very outspoken about having businesses open and being able to try to manage this responsibly, and it seems with some of these latest public health orders, at least from my perspective, that it seems like the governor is trying to not shut things down as maybe much as they were before, but to provide this training, to provide some of these other ways that we can try to manage this pandemic responsibly, but still with the understanding that businesses are suffering because they have lower capacities and things along that line. That may be just my perspective. I don't know what yours is, but do you see that there's some maybe leeway with some of these new public health orders, that things aren't getting maybe shut down so in such a draconian way as they were maybe earlier on, but they are trying to at least let commerce continue?
Yeah. No, I agree with you 100%. And I think because, I've said this on my own radio show. I mean, every Thursday in the morning, I have this, little butterfly feeling in my stomach of what's going to happen today. And of course, I'm fielding texts and calls and emails from concerned people all across Farmington saying, "What is she going to tell us? What is she going to tell us?" And this has been the model now for every Thursday for the past 7 months. And this week it went to Tuesday, and so that was even more anticipation. Oh my gosh, okay, it's a Tuesday event now. What are we going to see? What's going to happen? And I was glad to see that we're trying to find some other solutions to this that don't include just complete shutdown of businesses and furloughing of employees, and which from the very beginning we have been talking about those concerns. This is about the comprehensive health of communities, the physical, the mental, the economic, and how do we come together with some strategies, some plans that we can maintain some normalcy in our lives, but be responsible in our daily activities. And I would like to say this: I believe that when I drive around and I see people in stores and restaurants, and I mean, people are doing the right things, and the things that I believe that they feel are doing what they need to do to protect themselves and protect those around them. I think people have done a really fantastic job. I mean, changing human behavior and implementing new habits in people's lives and making people aware, and not just aware, but then now I have to react to, and I've got to make it a component of how I live. That's a very difficult thing to do. And I think it's made even more so, just by the general principles that we as Americans hold so dear. Your freedom, your liberty, all those things then just come to this mishmash. But, certainly I think there could have been better, initial guidance given maybe from the top down, and that would have helped people not battle through some of these things of questioning. But that's the era that we live in now. We live in the era of questioning everything, because you and I, based upon whatever things we're looking at online or whatever we're looking at on our social media feed, we're getting fed those things that most, that those algorithms believe we want to see. And unfortunately, that's led to even further and further divides for our people. But you know what? We're working through it, and I think people are becoming more aware of those things.
Sure. Does it seem to you, Mayor Duckett, that maybe the governor and maybe her team that she's getting advice from has maybe heard voices like yours from cities across our state about, how to maybe do this responsibly, but not having to shut everything down as much as it was earlier on back in maybe April, May?
I would like to think that. We've been a part of the Mayor's Council, since we released our economic declaration,
right.
Crisis declaration. I asked in that declaration that she form a Mayor's Council. She did that. So there's been 10 of us that have been on a phone call with her Chief of Staff every week, pretty much every week throughout June and July and August, and discussing with the challenges that we're facing, the challenges we're having with the different orders that she was putting down, and how can we work better with the governor's office and on behalf of our constituents. So I would like to think that was the case. I don't know necessarily, because even within those discussions, there were some give and take, a little leeway given, small wins, so to speak, that we were provided to certain sectors of the economy. But, not to the extent that I think a lot of us wanted to have them. And I think, Scott, the other part of it too, and this, I'm sure, talking to people on this particular show, but it's just in our daily lives, 45 minutes north of here, you have kids that are in school, you have kids that are playing sports. It's a whole different place. And that's a huge concern. I'm talking to a gentleman last night who told me, I love this city. I've lived here since 1958. I love this city, but I'm going to have to move. And I'm like, well, why are you moving? Because I can't take the governor. And these are some pretty drastic measures. But I'm seeing people who've moved to Utah. I'm seeing people who've moved to Arizona to try and get to a place where their kids can be in school full time. And that's the biggest motivation. But this gentleman is a senior citizen, and we're trying to attract seniors to this area. And he's so frustrated that he doesn't think he can stay in New Mexico. That concerns me.
Sure.
And I think that should also concern the governor and anybody who's trying to say, look, New Mexico can't be in the bottom of the barrel forever. We've got to find a way to attract people here and commerce here and industry here, and how can we do that? And in a crisis like this, you got to look across all ages of people, and you have to look across all income levels of people, and you have to say, how are each of these groups being impacted? If I'm a company looking at expanding, New Mexico, I think, is primed for investment. I think we are just on the cusp of a really big boom that can happen here in a number of different areas. But if you have the ability, no matter who's sitting in charge in the governor's office, to shut down single-handedly, just on their own decision-making. Now, I know she's got people who are surrounding her, who we're talking to, I get it. But there's a constitutional crisis that's occurred. The state representatives have zero say, and they've had zero say for 7 months. And the emergency continues. And I pray, and I've spoken to a number of members of our legislative body across the state and told them my biggest number one concern in this next legislative session is that we amend those Emergency Act orders. We have to amend it to where there's accountability from the individuals that we've elected to go represent us in Santa Fe, and we don't just have one person. Can you even imagine the weight that comes on just the governor? I don't know if she necessarily wants to have all of that weight on her. I don't know. I know I wouldn't. If people were elected to represent the bigger, greater communities of New Mexico, I would want to have their input, their voice, their vote, and how we move things forward. And I hope that they agree, and I hope we see some movement in that. I just think it's irresponsible on our part.
Understood. And I was going to just point out too, Mayor Duckett, as you were mentioning that we did have a special session midsummer. The legislature did convene to talk a budget and things like that. But of course, the legislature doesn't have much say as to what gets on that agenda for a special session. But we do have a 60-day session coming up in 2021. And so I would assume if the lawmakers think there needs to be a change in how those public health orders are given out, or how much authority the governor has during a health crisis, which is what has given her this authority, they would make those changes, and that's, I guess, how democracy is supposed to work. So
I hope they recognize. I think it's difficult until you've been through an experience like this, because you got to look at what, emergency orders. What was in mind when they enacted those orders? Why was it done the way that it was done? And now you've got hindsight. So with hindsight, you have to learn. You have to get better. It's just like anything we do in our lives. If we attack a problem, we go at it and we look at it on the back end and then debrief and go, okay, we probably could do this better if we did it this way. I hope at least one of the things that they consider.
Right. Understood. Let me ask you a bit as we look forward, Mayor Duckett, about the facts that maybe we'll be in this situation for a few more months. Who knows? First quarter of 2021, maybe vaccine out midsummer. We're hearing lots of different things, as we always do. But what's your advice to the business owners, the residents of our city to kind of keep on keeping on?
Well, I think they just have to incorporate in those. You still have to manage the spread of the disease, and I think you have to ensure that you're washing your hands and you're limiting interaction with people outside of your household. Like these are common sense type components, and I think people understand that. I know you kind of have to reinforce those things, and I certainly believe that people are getting a little bit tired. The fatigue, right? What is it called? COVID fatigue. You're getting a little bit coming to a point where you're going, okay, enough's enough. Are all these things really helping? And I think you have to believe that the basic things matter. It's the same things we talk about every flu season. How do you limit the spread of the virus? You do it by washing your hands and not touching your face. And those things have to continue moving on. So I just encourage people to manage this for their household appropriately. If they're in a position where their health could be compromised, you've got to take the necessary steps to ensure that you're taking care of you, and know that there's a community that surrounds you who are willing to help with whatever it is that you need. And, we just had a great Mayor's Table episode with San Juan United Way, PATH, and Desert View Family Counseling. There is a huge nonprofit component of Farmington that wants to support, and not just people in Farmington, but all of San Juan County, and is here for them. And so whatever that problem may be, you're having a problem with rent, you're having a problem with child care, you're having a problem, whatever, food. San Juan United Way's got a hotline, 211, call it, and they will call you back and put you in touch with people who need your help, who can help you. And then, of course, from the mental component, we have certainly seen here in Farmington, and we've tried to look statewide at what maybe the greater scope is of the stress that's being caused right now on individuals and households, and making sure that people are taking care of their mental health. And a lot of that has, my opinion, I finally have come out of some of this thinking, okay, I've got to get back exercising. I know that when I exercise, I mentally and physically feel better about myself. The day seems a little bit brighter. I feel like I'm accomplishing something. And so I encourage people to still get outside. Start a simple exercise routine of 30 to 40 minutes a day where you're out walking or running or weightlifting or whatever the case may be. Maybe just go out and playing catch with your kid in the yard. Doing something that gets you outside and away from thinking about maybe what's happening on a daily basis that is depressing, because certainly there's a lot of that component. And the only way you can combat that is by energizing your life and recharging yourself with positive things and positive people. And the last thing I would say, Scott, to tell people is get off the social media. Get out of that environment. I know it's a huge component of getting information. I think you should use it for getting information, but the best thing you could do is not read comments. Just get the information that you need off of it, and I think it would make a huge change in people's general attitude about the world that we live in. This community, through the last 7 months, has shown its true character. We have managed things in a very common sense mentality. I believe people have shined and organizations have shined through here and helping one another. And I've seen in every grocery store, I'm still smiling at people even with the mask on. I'm still smiling with people. I'm still engaging with people. And we have to continue that social part. Being social is a huge piece of this human life, and it adds value to it. Let's not give up on that.
That's good advice, Mayor Duckett, and I appreciate that, and I appreciate you being on the program this morning. Thank you for joining me and sharing some of this information. And you're right, we have a lot of resources for folks. The city has been a really great clearinghouse and a repository of some CARES Act funds and things like that for local businesses, yes, and things like that. The county, I know, is working with ECHO about rent assistance and utility help. You mentioned some of those things. So there are definitely a lot of resources, and the San Juan United Way can certainly get folks connected to all of them, I think.
Certainly. And the CARES Act funding that we got, we've given a large portion, tens of thousands of dollars to ECHO and San Juan County Partnership specifically for the need for food, the need for rent assistance. These are staples. These are things that people and that are suffering right now. We want to make sure they know that there are these resources available to you and your family, and it's just a click away or a phone call away, and we can get you that information in your hands and make sure that that you're getting taken care of.
All right. Very good. Mayor Nate Duckett, thank you again for joining me this morning. We appreciate your time, and it's always great to talk to you. Thank you.
Thanks, Scott. You have a great day.
All right. You too. Thank you. That's Mayor Nate Duckett, Mayor of Farmington, my guest here on our COVID-19 local information program on KSJE. And let's move along to some of the other things we want to share with you this morning on our get-together here, and that is some upcoming flu shot clinics. Of course, everyone is talking about staying healthy and doing the right thing, of course, and the flu season is coming. We know that. And, of course, we don't want to overwhelm our hospitals. We don't want to overwhelm them with COVID cases. We don't want to overwhelm them with flu cases this fall. And so San Juan Regional is having a couple of drive-through flu shot clinics. The first one is actually Saturday, October 24th, from 9 a.m. until noon. It is in the North Visitor Parking Lot, Lot F, at the corner of Maple and Schwartz at San Juan Regional Medical Center. The second one will take place a week from Saturday on Halloween, October 31st, 9 a.m. to noon, same location. And so they're asking that you wear a mask, bring your cell phone, and you can call and register once you're in line and give your information over the phone. And it is basically just a drive-through flu shot clinic. Probably wear a short sleeve shirt or something you can roll up and be able to get your flu shot as you drive through San Juan Regional Medical Center's flu shot clinic schedule. Again, Saturday, October 24th for our radio audience, and then Saturday, October 31st, 9 a.m. to noon. San Juan Regional, corner of Maple and Schwartz in Farmington. The testing schedule for COVID-19 is still happening, of course, here at San Juan College tomorrow from 7:30 a.m. until 9 a.m. And then next week, 3 different days, Monday, Wednesday, Friday. That seems to be the new schedule that the Department of Health is doing the COVID testing here at San Juan College. On Monday, October 26th, a couple of different opportunities in the morning and afternoon. So from 7:30 a.m. to 9 a.m. here at San Juan College. And then again on Monday, the 26th, from 4:30 p.m. until 6 p.m. here at San Juan College. Wednesday, October 28th, here at 7:30 a.m. to 9 a.m. in the morning. And then Friday, October 30th, 7:30 a.m. to 9 a.m. here at San Juan College. And, of course, the location is always the same. That is in front of the Henderson Fine Arts Center. You can kind of drive straight through. You can register online, cvtestreg.nmhealth.org. You can also call if you need help, 327-4461. That's 505-327-4461 to get registered for your test, and in order to get your results, of course, just as quickly as you can. Let's take a look at some of the other numbers that we like to share with you on these programs. Of course, Johns Hopkins, who've been tracking, as we say, the COVID-19 cases since the very beginning of this pandemic. We are now looking at the United States with 8,342,228 cases. Our death numbers in the United States are now up to 222,263. And as we can see and we talk about, we are leading the world in the number of cases. India is coming up 7.7 million, Brazil 5.2. 1.4 million cases in Russia and 1 million cases in Argentina are the next hotspot countries at the moment. Here in New Mexico, some sobering numbers to show you, reported yesterday. These are numbers from Wednesday. 827 new cases in our state. That is a record. That is the most daily cases that we have seen. We have been talking about how the numbers are increasing across our state. Certainly governor has been talking about how concerned she and her other cabinet secretaries are about the increase in cases that are coming in. So we're now at 38,715 in San Juan County, and we have again seen an increase from the single-digit numbers that we have seen for a very long time, but now we're seeing more double digits. Yesterday, no different. There were 25 new cases reported here in San Juan County, now a total of 3,653. There were 8 additional deaths in our state yesterday for a total now of 950. None of those were from San Juan County. We are grateful for that. And the recoveries in New Mexico now an additional 167 for a total of 20,332 recoveries in New Mexico. So again, I know the governor and everyone is cautioning folks to be careful, to stay safe, and as the mayor mentioned too, to keep practicing these COVID safe practices as these numbers increase. Taking a look at the other news stories from our website, ksje.com/news. The amended public health order in New Mexico that begins tomorrow. Again, the state is trying not to shut everything down, it seems, but asking, as the mayor said, restaurants to go through this free training to be able to maintain some of their indoor dining numbers and capacities, and outdoor dining capacities until the weather gets colder. But they are going to start publicizing and shutting down businesses if they have more than four contract tracing, 4 rapid response in 2 weeks. Then those businesses will be temporarily closed for 14 days. And so that was part of the latest health order. There's more details on our website, again, ksje.com/news. Navajo Nation reporting their numbers, of course, 29 new cases yesterday. Total now on the reservation, 11,030 cases. No additional deaths, so that number still stands at 574 deaths on the reservation. And again, there are 7,403 individuals recovered from COVID-19 on the Navajo Nation. So again, we are grateful for all those recoveries. Something we haven't shared in a couple of months here is the state dashboard for COVID-19 cases in New Mexico. As we've been talking about, the numbers are increasing, and you can see on this map from green to orange to red. The hot spot in our state seems to be southeast New Mexico, the Roswell area, the Carlsbad area, the Hobbs area, a little bit in the northeast corner, and in the southwest, Doña Ana County, Las Cruces, of course, and places in the boot heel of New Mexico. But take a look at the orange, San Juan County, as we've been mentioning. Numbers had been doing fairly well, and we are back into the orange, which is a concern. That's indicating increasing numbers, increasing infection rates, and so that is a concern, and that is why we're no longer green. We were green for a long time, but that is not the case these days. As we scroll through, we can see the actual numbers from San Juan County, and again, these numbers are from September 29th through October 12th. The average daily cases, 8 or more per 100,000, and test positivity rate under 5%. Our positivity rate is 4.6, and our cases per 100,000 has been 8. So that gets us into the orange category. So still manageable, but again, I think we're on that cusp. If we're not careful, we could go red. If we're careful, we could maybe go back down to green, and we are grateful for that. So again, those numbers are available all the time on the State Department of Health's COVID-19 dashboard in New Mexico. So we share that with you as well. Let's hear now from Dr. Brad Greenberg from San Juan Regional Medical Center. Joining us now for an update on his work at San Juan Regional Medical Center, Dr. Brad Greenberg is on the phone with us this morning. Dr. Greenberg, good morning.
Good morning.
Always great to speak with you, and we wanted to ask you, well, we always have these burning questions every week to ask you and the other medical colleagues at San Juan Regional Medical Center about the latest news that we're hearing about with COVID-19. So let me ask Megan to get us started, because I know you have a lot of questions.
I do, as always. So let's talk about fomite spread, or spread on surfaces, because there seems to be some new info about that. And
Fomite, different from Vegemite,
yeah.
which is Australian.
Yep.
And a different kind of spread.
Yep.
Please continue.
Okay. Thank you for breaking that down for us,
You're welcome.
my lovely co-host.
Here to help. I'm here to help.
And if we do find this virus is unsurfaced for a long time, do they remain infectious?
So, Megan, that's a great question. There has been a lot of development in our understanding of fomite spread. And so fomite spread, essentially, we usually talk about aerosol spread or droplet spread, and that's where you would inhale the particles. Fomite spread is where it's like sitting on a surface, you touch it with your hand, and then you may take that particle, which is on your fingertips, and then you may transplant that, or auto-inoculate yourself, put it in your mouth, in your nose, or rub your eye. So you can't get the illness through your skin, but you could perhaps carry it on your skin and then stick it on a mucous membrane. So the component of fomite spread really is still somewhat up in the air. So we like to we like to try to understand, well, how long do these things last on surfaces? And it is a good point that you bring up, is sometimes those things can be detectable, like you could find with a laboratory test. There's bits and pieces of COVID-19 on a surface. But really what we care about is how long are viable, transmissible, or infectious viral particles actually present on those surfaces that you could actually get sick from. There are illnesses like respiratory syncytial virus, or RSV, that are known to be pretty hardy on surfaces like that. And there have been some conflicting studies. Early in the pandemic, there was a cruise ship where you'd find these things on the surfaces for 14 days, but we weren't really sure if those were infectious. And more recently, there's been some discussion about both, I think it was paper bills, like money, and also smooth surfaces where the virus seemed to persist. And there was a question about whether or not it was transmissible. So it's still somewhat of an open question. With the recent information, we actually revisited some of our policies to determine whether or not we needed to make any changes. And really the most important things were about hand washing frequency and about making sure that you're occasionally disinfecting high-touch surfaces. So we didn't make any modifications to our policies at the hospital because we were already paying so much attention to frequent hand washing and frequent disinfection. So good question, but common sense practices are the response to it.
Great. And I also have a question about antibodies, because that has been in the news for quite some time, actually, testing blood for antibodies. And how long do antibodies remain in our systems, and is there a difference between whether the person infected was asymptomatic or symptomatic?
So two very good questions. So, and the answer to both, of course, is it depends. But I think that antibodies remaining in the system, it really can vary. Most coronavirus, or not, you'd say not COVID-19, but other forms of coronavirus are the common cold. And it's pretty well known that coronavirus really can provoke an antibody response, but that antibody response only persists for, say, 3 to 6 months. But other illnesses sometimes confer lifelong immunity. And those kinds of things also we like to seek out when developing vaccinations, for example, where you'd like to have a single vaccination that would confer lifelong immunity, where you'd have antibodies that would persist. So every disease is a little bit different, and we continue to try to develop an understanding of what happens with antibodies and how long they last. Now, there has been some discussion about, does the severity of your illness that you would get with COVID-19 impact your basically the production of antibody? And it seems, again, there's a lot of study that's continuing with this, but it seems like it may be the case that if you have severe illness, you may have antibodies for a longer period of time. Now, we continue to develop an understanding as to what the antibody presence means. We'd like to consider that does mean that it confers immunity. However, there have been a series of cases that continue to be described that are about reinfection, which concerns all of us, is that perhaps having the illness once does not necessarily mean that you couldn't get it again. And each of these cases is notable because we try to study them and understand the why, and also try to continue to understand the immunologic responses that individuals or populations have to when they contract COVID. So a complicated answer to a question that I really wish we did have a definitive answer that we could reassure folks with. But really, in this particular case, I still believe that, this is an ounce of prevention is worth a pound of cure. And so do everything you can to not get the illness, and we'll continue to do the science to fill in the gaps about what happens and the immunologic consequences of it.
And Dr. Greenberg, I guess we're still learning more every day, aren't we, about these types of things? So that just goes without saying. I wanted to ask you a bit about the use of steroids in treatments that we've been hearing about. And I know that steroids are used for a number of treatments and things like that. Could you give us a bit of a maybe lesson on what steroids are and how they're being used, especially with COVID? But I imagine there's different types of steroids that can be used in different ways.
Absolutely. And so these steroids, they're not the kind of steroids, they're not anabolic steroids like the kind that that people would use to increase muscle mass and whatnot. These are glucocorticoids. These are what we're using essentially as a ways of modulating the immune response or the inflammatory cascade. And so there has been some consideration that perhaps blunting the overwhelming systemic inflammation that goes along with fighting infections may be, you might be able to if you could blunt that immunologic cascade, that you could have better outcomes in patients. And that's the whole goal with giving someone steroids, is that you're trying to reduce the overwhelming immune response or the cytokine storm, so to speak, and you're trying to prevent the consequences, with respiratory failure or low blood pressure, et cetera, that you would get with this unbridled inflammatory response. So timing has been a real issue, when you give the steroid and to whom, and when in the course of their illness. All those things are really under study. Initially, we thought that from a study in the UK that administering dexamethasone to these folks would reduce mortality. Now it looks like there are subsets of patients, and the timing of which becomes important to make sure that we give the steroid at the right time to the right subpopulation to reduce overall mortality. Steroids are a very frequently studied class of medications, everything from spinal cord injuries to systemic infections, or what we call sepsis, has had studies devoted to it that are related to steroid use. So it makes a lot of sense that we would try to extend their use to COVID-19. And so we're going to continue doing those and continue to try to match up the right patient with the right kinds of intervention, and then make sure that we stay abreast of all of the new research and development for this subclass of medication.
Understood. And still not kind of a one-size-fits-all then treatment for these COVID patients that you're seeing.
Absolutely. I mean, it really does seem that this particular illness is somewhat protean. There's a lot of different impacts to these folks, both in the acute illness syndrome, folks having no symptoms, minor symptoms, some symptoms that are sort of curious, like loss of taste and smell, and then those folks that have severe acute illness, and then those folks that have the COVID long haulers, or the long COVID folks that have weakness and neurologic findings, et cetera, myocarditis, a whole range of different kinds of things that we're beginning to understand. And so it does make sense that the treatments are tailored to the individual experiences, and we do our best to use all of those things that exist in our armamentarium to match up the right patients with the right therapies.
Very good. And speaking of treatment, there have been some studies suggesting that the mortality rate among hospitalized patients has decreased. Is this because treatment is being more refined, or is the virus possibly mutating before our eyes?
Oh, I think that's a great question, Megan. We're actually, I think it may be something more simple than that, which is that this is a novel illness. When this showed up and overwhelmed many facilities, and we didn't have a lot of experience with it, I think that it makes sense that we are getting better at taking care of the very sick over time. And as we refine our understanding and add different kinds of medications and different kinds of approaches to ventilated patients and whatnot, deciding who needs to be on ventilators, what kind of respiratory support they need, we're doing our best to reduce overall mortality and morbidity across the board. So it's reassuring that over time, even though we're still seeing large numbers of pretty sick folks, that we're getting better at taking care of these folks, and we're able to deploy a new and more advanced set of tools over time also. So I find it hard to, I know that there has been some variation as far as like when they do genetic or genotype sampling from some of the viruses, but I don't necessarily see substantial differences in the virus itself as it impacts our population. I think more it's our responses to it and how we're able to better support populations through the illness.
Yeah, some rapid speed learning going on. And then our last question today is a convalescent plasma update.
Well, so convalescent plasma essentially involves we've talked about this a little bit before, but it involves taking folks that have had COVID-19, and then they are kind enough to donate plasma, which includes lots of antibodies in that plasma, and then that is refined and then basically is transfused into populations that may benefit from that. Folks that are sick that may need an additional infusion of what we call passive immunity. Passive immunity, where you're basically delivering antibodies that are already made into another person. And so there has been some conflicting data about the utility, although presently convalescent plasma does have an emergency use authorization, I believe, from the FDA. But we're not using it as much at San Juan Regional Medical Center. We definitely do our best to make these things available. We find it very important to match up the right patients with the right kinds of therapies. Interestingly enough, the principles behind convalescent plasma, that is to say, infusing antibodies that came from somewhere else and into a patient, is the same principle that is behind the monoclonal antibody therapy that President Trump received, the Regeneron therapy, which is the infusion of antibodies that are not necessarily from another person, but they're engineered in a laboratory. And that is the same principle. So the convalescent plasma and that therapy are both still under study. And so it's definitely not, say, a slam dunk therapy that would vastly improve this. So this is just part of the scientific process where we're trying to create access, sometimes through compassionate use, sometimes through emergency use authorizations. Those are two different FDA labels for how patients can receive medication sort of before they go through the whole FDA process. But we're trying to improve access, and we're trying to improve outcomes. And so using different passive immunity strategies is part of the whole puzzle. And we'll use science and figure out how to move forward and get the best possible constellation of therapies available for patients in the Four Corners.
Very good, Dr. Greenberg. And I had one extra question, if you don't mind, and that would be just an update on vaccines. We are hearing that maybe some are in some of these maybe challenge phases of the vaccine, and maybe from the materials that you read and what you hear from your colleagues, kind of where do things stand? I think we're still several weeks or months out, aren't we, from a practical vaccine to be used in a big population?
I think that's correct. I think that the vaccines continue to be in development. I know three major manufacturers are in phase 3 trials, so large-scale phase 3 trials. But it does look like, as we would expect, as they give the vaccines to, say, 40,000, 50,000, or 60,000 folks, that in those subpopulations you're going to have events that cause those trials to stop and be examined. That is a normal thing. That tells me that the FDA process for safety is working just as designed. And so, but I do think that it's going to be some time before we see widespread distribution of a vaccine. The federal government did request each of the states to submit a vaccination plan. And the states and the state of New Mexico has also requested from us how we might be able to assist with the vaccination process and how we would do it. And so all of those things are in motion. So even though we may not necessarily have a vaccine in hand, so to speak, we're developing plans to rapidly distribute it to the population and to make sure that we work with our partners at the Department of Health to build a system that will be, at least in terms of a framework and an implementation plan, we'll be ready to try and distribute this to the population. So there's lots of work at every stage. The development is part of it, but then the distribution is also a Herculean task. And so we want to make sure that once we have it, we can actually distribute it. But I actually find, I believe that the emphasis on safety and the emphasis on efficacy is really what we need right now. We need to believe that this vaccine is going to work and it's going to be safe. And the fact that they're taking their time and doing this the right way is reassuring. And I think that when we finally have that tool, which will be invaluable, we'll we'll be in a place to make sure that it's available for those folks in the Four Corners.
Very good. Well, as always, Dr. Greenberg, it's a joy to have you on. Thanks so much for taking time out to speak with us today.
You bet. Thank you both for having me. And please be safe, wash your hands, wear that mask, and stay healthy.
Very good. Very good. Thank you, Dr. Greenberg, very much.
You bet.
That's Dr. Brad Greenberg, of course. We're always grateful for his time joining us this morning on our COVID-19 community information program. Speaking with Megan Cullip and myself, again, that was an interview. We talked with him yesterday here on KSJE. And that will wrap up our program today. We've shared a lot of information this morning. We thank Mayor Nate Duckett, City of Farmington, for calling in earlier. Also, Dr. Greenberg, of course. Megan will be back on Monday, and we hope you will be too. Of course, you can always check out this program Mondays and Thursdays live on Facebook, YouTube, and Twitter, 9 a.m., and also a rebroadcast Mondays and Thursdays at noon on KNMI Vertical Radio and KSJE right here every afternoon at 5:06 p.m. I'm Scott Michlin. Have a great and safe Thursday. Take care, everyone. Be safe. I'll see you back here on Monday for our COVID-19 Community Information Program.